Okay, let's start from the brief introduction. Our next topic. Let's check it. What's happening in browser. Yeah. Here you can see the guideline from NISA again. The next topic, anatomy of MidBraine. The list of questions you have to be familiar with. Pay attention about where they are. Excuse me. Yeah, this the decussation. Such a question will help you later to complete and to understand to complete the ascending and descending pathway. Because during your pathway introduction, you have to count the decussation. Some pathway has one decussation, some has no decussation, some has 3 decussation, and it depends. That's why I recommend you from now step by step to remember this decussation. That's why actually last time I pointed the corticospinal tract decussation, the decussatio lemniscorum, and the next set of decussation actually we have on the level of midbrain, a lot of tract decussation on the level of midbrain. This topic quite easy, but usually you have a problem with topography, with some particular part of midbrain and divisions of midbrain. That's exactly what I want quite briefly to introduce you. This is the classic cross-section of midbrain. I don't care, again, I don't want to ask you to recognize all the specific parts and points. The main object you have to know, the main parts and the main nuclei. I mean that first of all, of course, you have to know the peduncle, cerebri. I'm sure you do remember that we have peduncle cerebelli. Today's topic, it's one structures group. This peduncle cerebri for the brain, for the telencephalon, belong to the midbrain exactly. And the next we have tegmentum, and after that we have tectum. The border between the peduncle and tegmentum is substantia nigra. Substantia nigra, yeah. And it's quite well recognizable even on there, on MRI, like there. Here you can see more darker shadow area of substantia nigra here and there. The next on the level of tegmentum, you have to be able to recognize the red nuclei, the position of red nuclei. And that's all actually about some specific structure. All the smallest object not assist to recognize actually. You have just to know where they are located, in which part we can find nucleocranial nerves, oculomotor-trochlear, in which we can find the spinal nuclei of trigeminal, where we can find the spinal and medial lemniscus, and where we can find the lateral lemniscus too. That's all. That's about the cross-section and your ability to recognize something on the aqueduct, of course, cerebral aqueduct, no doubt. Tectum and tactile plate. It's all above the aqueduct, actually, the level of aqueduct. And a lot of issue you have with the functional understanding, the functional explanation of what is that tactile plate and what kind of centers we have here. Let's look first of all on the brain. And let's first of all define the main parts of the midbrain in the model. After that, to see the ventral part of the midbrain, we can absolutely easy on the frontal view. And again, on the front, what we have, let's back to the schema. On the front, we have pedunculate cerebri. That's why, first of all, you have to recognize what is that. It's a frontal or dorsal. It's a frontal. With what I can see, only pedunculate cerebri. Done. That's all. Because very common mistake on wet organs. Let's remove here the pituitary with the infundibulum and tubercineum. And very often on wet organs, this object, you misunderstood, you flip with the corpora quadrigemina of the tactile plate exactly. This is not, it's mammillary body. And it's quite common mistake. You see kind of bulbs and you claim, oh, this is the corpora quadrigemina, and this is one of the colliculi. No. That's why this is quite common mistake. Please start to try to avoid this. It's a ventral side, ventral surface. On ventral side, you can see no corpora quadrigemina. You can see just pedunculate cerebri, interpeduncular fossa with mammillary body inside and etc. and so on, so on. After that, we have to look at the back, and here to see the tectum, we need to remove the cerebellum, and after that we can see the corpora quadrigemina. It's like the dorsal design, dorsal view of tactile plate of tectum of the midbrain. In corpora quadrigemina we have superior and inferior colliculi. Superior and inferior colliculi. And usually you are introducing me that superior colliculi is a cortical center of visual system. Inferior subcortical center of acoustic system. Perfect, good. But you can't explain what does it mean, and you can't suggest what kind of symptoms or complaining of the patient in the case of damage of such centers. That's why let's try to think about that. Because again, we have a lot of subcortical center of any system, acoustic, sound, whatever. And this is one of the subcortical centers, pericollically one of the subcortical center of visual system. And this is for acoustic. And you have to understand for what exactly they're responsible in the entire set of function of acoustic and visual system. The superior colliculi is responsible for involuntary sudden involuntary reaction or sudden light or kind of visual object. If you see on some side view something moves, the car moves, or some another object, or the sudden light turn it on, your first reaction is to move your head on the side of that object. This is an involuntary reaction. You moving your head simultaneously with eyes, both eyes coordinate the movement with the head muscle of neck. And for that, we have exactly that center. That's why it's a mistake when you try to claim that in the case of damage of this center, the patient can't see. The patient can see because this is not optical, primary optical center, not a visual center. It's one of the subcortical center of visual system, responsible for involuntary reaction on sudden light or sudden visual object. Because now you can suggest what's happened in the case of damage of this center. No involuntary reaction. It doesn't mean that the patient can't rotate the head on the side of the visual object. Yeah, he can, but it will be voluntary. It will be a decision after the cortex provide the order to do that. And it will be, of course, with some delay. The object, after that, the patient need to understand that something. He sees something. He saw something, and after that he decided to react on that object. Because of course it will be the longer period of time compared to the normal involuntary reaction. But he can move the head and the eyes and the side of the object, and he can look at that object. Same inferior colliculi, but regarding to the sound system. If you hear some sudden sound, voice, car signal, whatever, you involuntarily rotate your eyes, your head, and the neck in the side of that sound. Involuntary. This is involuntary action. And for those of you who well read today's topic, you remember that particularly the lateral lemniscus gives the fiber from the cochlear nucleus after decussation to that exactly inferior colliculi, so-called cochlear tactile tract. And it looks on your schema like that, like projection from the location of area, cochlear area of rhomboid fossa to the mostly it's not completed decussation, mostly to the opposite side, and the part of the fibers goes to the same side too. That's how actually it's help us to recognize one of the method to recognize the direction to the sound actually. And from this side we have here and there. That's this again. In the case of damage of these centers, no problem to hear, no problem, because the main portion of from cochlear nucleus, the main way for acoustic system goes to the thalamus, to the upper part of the brain, to the encephalon. Here we have just a copy to excite actually that involuntary reaction to sudden sound. That's how it's works. That's why again it's another example that nervous system. It's important not only to remember the external features of some kind of part of brain, internal features, but to understand for what you need that. Because I'm not sure that all of you, after you graduate from university, will remember all the small objects of the midbrain, but you have to remember the functional most of that parts. And another important question again, it's actually the cranial nerve nuclei on the level of brain. Here you can see the location of them, and there too. I don't care your ability to recognize a particular location of this, and there is specific the histology section. Don't care. You have to know in which division, which part of midbrain located, and of course to remember them. Here we have the oculomotor nerve nuclei, two of them, primary motor oculomotor nerve and parasympathetic or accessory nuclei of oculomotor nerve, or Edinger-Westphal nuclei, whatever. The parallel, you can find a few another name for that nuclei. And trochlear nerve nuclei is ABC, in addition to the mesencephalic nuclei of trigeminal nerve also. But mostly the clinician takes care about the oculomotor and trochlear because they do it's very specific symptom. Simultaneous damage of these two nuclei, oculomotor plus trochlear, it's guaranteed you that you have to check the midbrain. You have to check the midbrain. The easiest way, actually. After that, you can check the red nuclei function. Maybe you will see the substantia nigra disturbance and so on. But first symptom you see in the case of some problem with internal midbrain structure, it's actually the oculomotor plus trochlear nuclei problem. That's all about theory. The peduncle again, the peduncle, please beg you, don't tell me that here we have kind of neurons and centers. This is only pathway. The peduncle cerebri, it's only descending pathway. We have corticopontine direction pathway, a few groups of here, and also we have here pyramidal system domain. It's corticospinal, your favorite, I'm sure now that you do remember that we have two corticospinal, one an anterior funicular spinal cord, another lateral funicular spinal cord, and I'm sure that you do remember about the causation of pyramids of this tract, and here we can find them again. Because again, we waited to the final destination, we tried to reach the final destination for this path, it's cortex. But each part of the brain, we need to find the position, the location of the cortical, spinal tract, corticonuclear in particular here, and the medial lemniscus as the main sensory tract. Without that, you can't pass the central nervous system. Those here again, pedunculate cerebri. The particular location of this tract is not a problem. You have to remember which one more medial, which one more lateral. You can find this in the book. It's not a big secret. But again, please don't make the mistake that here we can have kind of center. No, only pathway. Only pathway in pedunculate cerebri. Done. And only descending, only motor. It's pyramidal, extra-pyramidal system. It depends. We don't care about that now. Later we'll be talking about that. Now just remember that this is the descending pathway only. All ascending tegmentum. Here we have first of all the medial lemniscus, and again, a common question: what is the medial lemniscus? Every time we'll be asking. And the lateral lemniscus too. Here we can find as the first time we met the acoustic pathway. About specific nuclei of the midbrain, again, you have to read. It's not a big deal. There are just few of them. It's quite easy. But the decussation, please don't forget. Set up. Please be mercy. You want to destroy my brain. This ultrasound. Next. How you have to take a deal with the midbrain on the model. On 3D model, I told you, first of all, you have to recognize, is it dorsal or ventral surface or side view. On cross-section, cross-section. Yeah, here. What's happened? Lateral lemniscus I can show on this position actually. Here is absent on that model. Here we can find on the medial lemniscus, it's number 5 here. But again, yeah, you don't have to care about particular location because in caudal and the cranial location of midbrain, they quite different position. In the caudal, it's located actually there, and the medial limb is located there. On cranial, vice versa, because the decussation of lateral lemniscus occurs on the level of the midbrain exactly. That's why it's changed the position during the midbrain axis along the midbrain. That's why I will be just asking you where exactly it's located. Maybe in pedunculi, maybe on the tectum, not of course in tegmentum. That's all. It's enough. You have to recognize the red nuclei, the substantia nigra, the aqueduct, and the main parts, peduncle, tectum, and tegmentum. That's all. The number here, please, you don't need that. If you want to be a local specialist in neuroscience and exactly majority will be maybe brainstem, you can go back and you try to find the specific position of the H. lemniscus and fasciculus longitudinalis dorsalis, fasciculus longitudinalis medialis, and blah 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 and so on. Because here we have also specific the local white matter object as the two fasciculi I already mentioned. And for level of 5 you have to remember that, but not location, not location. It's too much for you. I will be asking you just the main parts on the model, on the MRI images, no specific location of spinal nuclei of trigeminal nerve or substantia grisea of the midbrain. Substantia grisea, by the way, around the aqueduct, it's not a problem. But again, don't try to spend a lot of time for such a question. Again, on the sagittal section, the biggest problem you have here, it's exactly if the section looks like that, wet over, without. If you have the question, please tell me what is that. You can't recognize what's that. This is exactly peduncle cerebri. Sagittal view, you can see here. Oops. That's there. Here it's like inner view of peduncle cerebri. Look at that. If the sagittal section was there, this will be a view on peduncle cerebri. That's all. This is the first mistake. Second mistake, you can't recognize where exactly we have the border between tectum and tegmentum. The aqueduct. That's all. Here we have aqueduct. Here we have tectum with tectal plate, corpora quadrigemini, and here we have tegmentum. And in front of tegmentum again, I'm sure now you know, peduncle cerebri. That's all what you have to recognize in the sagittal section, not more. Aqueduct, tectum, tegmentum, and peduncle. And the surface of interpeduncular fossa here. The superior collicle you can see here, even from the sagittal view, superior, inferior collicle, you can recognize that. On lateral view, let's do the same. If it's, for example, only brainstem model. If it's only brainstem model, on lateral view, again, just remember what we have in front. We have peduncle cerebri, small portion of tegmentum, and the tectum in the back. That's all. That's why as anatomic object, it's not a big problem if you understand the orientation. It's not a big problem. Quite mild theory we have, the decussation, but not a lot. If you remember previously, all the tracts here, ascending, descending, it's not a problem. You have just to add the cranial nerve nuclei, specific nuclei, such as substantia nigra and red nuclei, and substantia grigia, and specific white matter object.